Thyroid in Children, Understanding Emotional and Behavioral Changes. Imagine a child who suddenly becomes more irritable, anxious, or has trouble focusing. These changes can sometimes be linked to how well their thyroid gland is functioning. The thyroid produces hormones that are essential for brain development and mood regulation, especially in growing children. When these hormones are out of balance, it can lead to noticeable emotional and behavioral shifts. Children with hyperthyroidism, which is when the thyroid produces too much hormone, often show signs like being overly anxious, restless, or easily upset. They might have mood swings or act impulsively. Some children may also have trouble sitting still or concentrating, which can look like attention deficit hyperactivity disorder. Physical signs such as shaking or tremors can also appear. These behaviors are usually temporary and tend to improve once the thyroid hormone levels are brought back to normal through medical treatment. On the other hand, hypothyroidism, where the thyroid produces too little hormone, can cause children to feel more tired, sad, or withdrawn. They might seem less interested in activities or have difficulty with memory and learning. These emotional changes can sometimes be mistaken for depression or other mental health issues, but they are often rooted in the hormonal imbalance. Correcting the thyroid function usually helps improve these symptoms, but sometimes emotional challenges persist even after hormone levels are normalized. Research shows that children with thyroid disorders, especially those with Graves' disease, often experience both internalizing problems like anxiety and depression, and externalizing issues such as attention difficulties and social challenges. Early diagnosis and treatment are key because untreated thyroid problems can impact a child's emotional health and development. Even children whose thyroid levels are stabilized may need additional support, like counseling or behavioral therapy, to help manage ongoing emotional or behavioral concerns. It's also important to remember that maternal thyroid health during pregnancy plays a role in a child's development. If a mother has thyroid issues during pregnancy, it can increase the risk of behavioral and emotional problems in the child later on, such as hyperactivity or impulsivity. This highlights how vital it is for expectant mothers to have their thyroid function checked and managed properly. From a medical perspective, recognizing that these emotional and behavioral changes are linked to thyroid hormone levels helps healthcare providers develop effective treatment plans. Managing the thyroid disorder with medication, and sometimes surgery or other therapies, can significantly improve a child's mood and behavior. In addition, behavioral support or therapy can help children cope with lingering emotional challenges and improve their social interactions and overall quality of life. In summary, thyroid issues in children can cause a wide range of emotional and behavioral changes, from anxiety and mood swings to attention problems and hyperactivity. These symptoms often get better with proper thyroid treatment, but some children may need extra help through behavioral or psychological support. Early detection, comprehensive care, and ongoing monitoring are essential to help children thrive both physically and emotionally. Always consult healthcare professionals for personalized advice and treatment options tailored to each child's needs.